Hello everyone, I'm Dr. Yende. Let me start with a question. When your smart ring measures your sleep, who owns that data? When it flags elevated stress, who owns that information? When it tracks heart rate variability, oxygen saturation, recovery scores, movement patterns, body temperature, and something like physiological age, who ultimately controls those insights? You, the company that built the ring, the cloud platform storing the data, or an algorithm you've never even heard of? Tonight, we'll explore one of the most important health questions of the next decade. Not longevity, not sleep, not biohacking, ownership. Who owns your biology in the age of artificial intelligence? Because every night while you sleep, your wearable may be creating one of the most valuable digital assets in the world. You. Most people think of a smart ring as a fitness gadget, a sleep tracker, or wellness toy. But from a data science perspective, it's far more powerful. It's a continuous biological sensor. Every second it records heart rate variability, respiration, activity, recovery, temperature shifts, circadian rhythms, stress patterns, even early signs of illness. Over months and years, those measurements build something remarkable. A digital biological twin, a continuously updated model of your physiology. The question is, who controls that twin? Imagine someone follows you for a decade, not with a camera or GPS, but with physiology. They know when you sleep, when you're stressed, when you exercise, when you travel, when you get sick, when your recovery drops, when your heart rate changes, when your biological age accelerates. That's not science fiction. It's increasingly possible. And the value of that information is enormous, because biometric data could soon outstrip financial data in worth. Think about why. A credit card shows what you bought. A biometric profile shows who you're becoming. It reveals trends before symptoms, hinting at potential illness, burnout, poor recovery, metabolic trouble, sleep debt, cardiovascular risk, and perhaps one day, cognitive decline. Your wearable might know more about your future health than your annual checkup does. That's powerful. And power creates responsibility. Most wearables don't just store data on the device. The data travels from the sensor to your phone, to servers, to cloud infrastructure, to analytics engines, to AI systems, often passing through multiple layers of processing. Each step raises questions. Who has access? Who analyzes it? Who can monetize it? Under what terms? Most users click "I agree" without reading 20 pages of legal text. Understandably, but those agreements often include permissions for processing, anonymization, aggregation, research, and analytics. While many companies act responsibly, the average user rarely understands the full journey of their biological information. AI changes the game. It doesn't just collect data, it interprets it. A heart rate of 70 is just a number. 10 years of heart rate patterns is a story. Machine learning excels at spotting patterns, correlations, and predictions. Predictive systems become incredibly valuable. Imagine an AI that flags elevated diabetes risk years before diagnosis, predicts burnout before you notice, or detects falling recovery before performance suffers. These tools could transform medicine and save lives. But they also raise ethical questions, because prediction shifts power. Picture a future where an insurer has access to advanced biometric risk models, not your diagnosis, but your probability, your projected health trajectory. Would premiums change? Would coverage? Could employment or lending decisions be influenced by your risk score? We don't know, but these are questions we must ask now, before technology outruns regulation. The problem isn't the tech itself, it's governance. Who sets the rules? Who audits the algorithms? Who verifies fairness and prevents misuse? Every powerful technology forces society to answer the same question. How do we maximize benefit while minimizing harm? The internet forced that question. Social media forced that question. AI is forcing it again. Biometric intelligence may be the next frontier. Let's be balanced. Wearables deliver enormous value. They help people sleep better, move more, recover smarter, spot trends, and raise health awareness. For many, they're the gateway to healthier habits. That's a win. One of the most exciting shifts in healthcare is moving from reactive to proactive medicine. Instead of waiting for disease, we monitor physiology. Instead of waiting for symptoms, we watch trends. Instead of annual snapshots, we build continuous health intelligence. But continuous monitoring must come with continuous trust. I believe the future belongs to data sovereignty, the idea that people should have meaningful control over their biological information. You should know what's collected, why it's collected, where it's stored, who can access it, and how it's used. Transparency shouldn't be optional. It should be foundational. Biometric data is different. You can change a password or replace a credit card, but you can't replace your physiology, your heartbeat, your nervous system, your biological identity. This matters even more as sensors advance. Today's rings measure sleep and activity. Tomorrow's devices might track glucose, hydration, stress hormones, inflammatory markers, neural activity, continuous blood chemistry, or signals we haven't even discovered yet. As sensing improves, protecting autonomy becomes critical. The future of health isn't just about gathering data. It's about ensuring individuals remain the primary beneficiaries of that data. The goal should be empowerment, not surveillance. Insight, not exploitation. Prediction, not discrimination. Partnership, not ownership. Technology should help people understand themselves better, not turn human biology into a product. The future of healthcare may be wearable, continuous, AI-driven, and predictive. But if we're going to build that future responsibly, one principle must come first. Your biology belongs to you. Your data should work for you. Your health intelligence should strengthen your freedom, not diminish it. In the age of artificial intelligence, ownership may be the most important health metric of all. I'm Dr. Yende. This is OXYZEN Health Intelligence. Before I go, would you share your wearable health data if it could improve healthcare? Or do you believe biometric data should remain completely private? Let me know in the comments below. The future is already being written. Who gets to hold the pen?